Dental anxiety can be expensive. Procrastination is the real problem here. Small dental problems, when not addressed and put on the back burner, eventually grow and become more involved, requiring more sophisticated and more involved solutions to fix a problem that could have been addressed earlier on. These more sophisticated solutions obviously have a higher cost and probably take longer to fix than something that's simple. Let's look at a case where we have somebody who waited far too long and allowed their anxiety to get the better of them and push off treatment that could have been easily handled in the beginning stages of when it came on. This young lady, unfortunately, was dealing with a severe situation of dental anxiety. And I know it's really common. It happens in a lot of people. A lot of people come to me and tell me that they're very nervous about having surgery or needing dental treatment or even getting into the dental office. She was able to work up the courage to get into the dental office to see me. And let's talk about what we did, what the issues were, and how that situation was resolved. We're looking at a smile photo here, and we can see some obvious problems. Even just in the smile, we can see what's called a calculus bridge, and that's hardened food debris that harbors bacteria and causes you to lose gum and bone and eventually makes the teeth loose and have infections. Taking a closer look in the mouth, we see that we're missing a front tooth here. We can also see that we're missing a couple back teeth here and how bad gum disease has actually gotten. Take a closer look at the upper. We see a few broken down teeth here. We're missing a few teeth here, and we see some decay going on in between these teeth as well as here. On the lowers, we see a situation where there's a lot of buildup, a lot of calculus here. And that's that hardened food debris that never got removed from regular 6-month cleanings and annual checkup. This is not something that happens overnight. It takes years and years to develop. We know that those easy visits to the dentist were maybe put on the back burner or avoided due to anxiety. Taking a look at the back teeth, again, we see those missing teeth there, and we see just a minimal amount of space there. So we know that the bite has collapsed, and we see something that's very common in bite collapse is that these front teeth start to get splayed and they flare out and they move out of position. So the back teeth don't work, they overload and stress the front teeth, and they cause those front teeth to move out of position and not be functional anymore. What was the solution that we decided on? We decided to make a beautiful set of dentures for this young lady. Again, her anxiety was preventing her from going through a more involved surgery, like say full arch implants or an implant overdenture. But this was the good solution for her that addressed her health concerns, fixed some of her dental concerns, and I would consider it progress in getting her a healthy set of biting teeth that work together, that bite and chew her food, and get rid of the gum disease, the infection, the decay that's in her body, and get her into a much healthier state. So what are my recommendations? First of all, I would address small problems when they're still small. See your regular dentist, take care of the minor issues, and overcome that anxiety. Nowadays, we have a lot of solutions that can help you as far as sedation, and medications that help you relax and take the edge off so that it's not such a stressful experience. Modern dentistry is much more comfortable than it used to be. If we procrastinate and these problems get larger, then I recommend seeing a prosthodontist if we're seeing some larger situations that need an expert set of eyes to take care of and address. Thank you.